What is the end goal in behavior therapy? I specialize in working with dogs who are chronically dysregulated, so dogs with anxiety disorders or trauma disorders, dogs who are chronically hyper-aroused. And for many of these dogs, take anxiety disorders, for example, we're not talking about curing anxiety, just like we don't cure anxiety in humans. And my very meta answer to that question is that behavior therapy work is never really done because it's less about capital T training and more about changing the way that we perceive and support our dogs, the way that we fashion their lives so that they can be successful. Whether or not we're actively working on behavior modification, we are likely always adapting to how to best support our dogs as they move through various stages in life. But I want to give you sort of a non-meta answer as well. So I'm going to give you the example of my dog Amore. Amore is diagnosed with generalized anxiety disorder. She had a known traumatic early environment, and she's experienced known trauma. Behaviorally, that has most primarily presented as fear-based aggression towards strangers, handling concerns specifically with people who aren't in her circle, and in the past, some intra-household aggression. And as part of her constellation of behaviors, we've also seen leash reactivity. I made a lot of mistakes early on in my attempts to support Amore, which contributed to her trauma history. That included taking a leadership style training approach. But once we got on the right track, it was a combination of pain management, behavior medication, solid management, appropriate enrichment, which means a lot of things, but it also means I stopped trying to physically exhaust her. We increased agency, prioritized consent. Becoming a safe person and creating safe spaces was huge. And honestly, we didn't do much capital T training work. We set up a protocol that supported her in easily making new friends and adding them to her circle. We took time building a relationship with our vets so that they weren't strangers or scary to her. We built in a flight cue. We practiced building self-regulatory skills. We use engage, disengage, and pattern games for support and for counter-conditioning opportunities when we're out and about, all while aiming to stay within her window of tolerance. And the end shift looks like this. We've gone from a dog who would never be comfortable on a leash or walking in a neighborhood, who is now confidently and easy walking multiple miles in our neighborhood each day. A dog who can easily allow people into her inner circle, often within one visit. A dog who can be physically examined with minimal sedation by a brand new vet at a specialty center as needed, and who can not only tolerate it, but actually had a positive experience. She's a dog who just now, while we are walking around the neighborhood and I left my treat pouch at home, found herself 10 feet away from being face to face with a strange dog and responded easily to the flight cue and got us out of there. Amore can travel and she can go out in nature. She's never going to be the dog who wants to go to the farmer's market or the brewery. She's never going to want a stranger in the neighborhood to come up and pet her. She will always be a bite risk. Her tolerance levels are lower when she's in pain or having a GI flare. I will never stop taking treats on walks, intentionally. But she is living a happy, full life, and she is living a happy, full life that is bigger than it could have been years ago. She has dog friends. She hikes off leash. She feels safe staying home alone. She can bounce back from stress events quickly rather than taking her down for weeks. She can explore new places or encounter new stimuli without becoming afraid. Or if she is afraid, that fear is overcome by curiosity and she bounces back quickly. And what the beginning picture looks like and the end picture looks like is going to be different for different dogs. But this is a dog with multiple level 3Bs under her belt. This is a dog who has experienced a lot of stress and trauma, and a lot of it very early on. And so we don't cure anxiety disorders in dogs, but we can dramatically improve their well-being.